Good evening and welcome to Local Doctors on Call. I'm Suzanne Lee. I'm joined by Dr. Misha Payant, president of East-West College of Natural Medicine on North Tamiami Trail in Sarasota. This is a live call-in show where your participation is encouraged by calling 361-4675. That's 361-4675. And Dr. Payant, tonight we are going to focus on Oriental medicine to heal digestive issues, something we all seem to be struggling with at one time or another.
Absolutely. These are very exciting times because right now the research being put out today validates what traditional Chinese medicine has been teaching for over 2,000 years, and that is the gut plays such an important role on overall health and well-being.
What does digestive health really mean?
You know, what we know now is that 99% of all our genetic material doesn't belong to us. It belongs to the bacteria in our guts, the bacteria that call our intestines home. That this bacteria is doing things like lining the gut so as to prevent what we call leaky gut syndrome in building the integrity of the gut wall. These bacteria are modulating the way we think and feel by creating the neurotransmitters like the happy neurotransmitter serotonin and dopamine. That these bacteria are determining if we're going to be obese or if we're going to be thin.
I want to take you back a step. What is leaky gut?
Leaky gut syndrome is when the gut lining isn't closed all the way, if you will, that there's been inflammation and particles are able to leave the gut and go out into the system, the body, and then the body won't recognize that as self and it'll start to attack it. So that creates inflammation and chronic disease.
Is there a common theme with bacteria diversity among people?
Absolutely. What we find is a healthy person has a very diverse bacteria ecosystem, if you will, in the gut. Just like the rainforest. The more diverse the rainforest is, the healthier it is. The same thing goes with the bacteria in our gut. And what we find is people with, say, for instance, ADHD, autism, obesity, these people have bacteria that's not diverse at all.
I want to remind our viewers that this is a live call-in show and our telephone number is 361-4675. That's 361-4675. Give us a call. We would love to take your questions here live on Local Doctors on Call. Doctor, I want to ask you about the gut-brain axis. What is that?
Sure. There's a direct correlation between the gut and the brain, that it's basically a superhighway of neural connections. The bacteria in our gut basically will tell us if we're feeling happy, if we're feeling depressed, if we're feeling anxious.
So what is that for some people? Why is that different for some and not others?
Sure. Again, if a person has a bacteria flora that's not diverse, they're going to have what's called dysbiosis or just a gut flora that's not harmonized. And this will have a direct impact on the ability for these bacteria to create serotonin or dopamine.
So if you can, tell us a little bit more about the role that our gut plays in our mental health.
Sure. Again, what we can find is we can basically change a person that has autism and create a bacteria flora that's more conducive to having better speech patterns or being more sociable by doing what we call fecal microbial transplant. It basically is just as it sounds, taking the fecal material from a healthy individual and implanting it into someone with a chronic illness, say like autism, and we can see then that these symptoms are relieved. Now, that's not, of course, a procedure that we perform at East-West College of Natural Medicine. I'm just talking about it now to emphasize the importance of a healthy gut bacteria.
So those families that have autistic children, have they tried this as a solution for them?
Yes, actually, there is a university, I believe, in Kentucky right now that is doing the studies and recruiting autistic children for this procedure.
We're going to take a call from Kelly now. Hi, Kelly. You have dialed 361-4675. Kelly, thanks for joining us. Good evening.
Good evening.
How can we help you tonight?
I've heard that probiotics are a good way to balance your gut, but there's so many different kinds with different, ones for large intestines and small intestines, and they say to have so many billions. And I was just wondering is that the best option, and what would be best?
That's a really good question. And a lot of people with GI distress think a probiotic is what they need. And in some cases, that's the case. However, we have to know exactly what's in the gut to begin with. So for instance, if we ran an organic acid test and found that your particular gut has an overgrowth of acidophilus, and I find this with patients quite often, most probiotics have acidophilus. So if you took a probiotic off the shelf, not knowing what's in your gut to begin with, you can make a bad situation worse.
I wasn't aware that there were so many different types of probiotics to treat different things. Thank you, Kelly. Did we answer your question?
You did. Thank you.
Thanks, Kelly, for calling. Feel free to call us as well at 361-4675. We'd love to take your calls tonight. Back to the probiotics, though, I am curious about that. There are so many types on the shelf.
Absolutely.
So you can make that mistake then?
Absolutely. Without knowing what's in your gut to begin with, you can really make a bad situation worse. Excuse me. What we find is it's not the number of probiotics. So for instance, as Kelly mentioned, some probiotics have 1 billion of this, 1 billion of that. That's not as important as the diversity of the probiotic. So one of your best probiotics are going to have probably 12 different strands of, for instance, lactobacillus and bifido strands, but it's not the actual, again, number, it's the number of variety.
So tell us more about some of the testing that you can do at East West College of Natural Medicine to determine maybe what some of our personal markers are for ourselves.
Sure. We do a variety of tests. One is an organic acid test. It's a urine analysis, and that tells us exactly what the patient is deficient in nutritionally in the regards to carbohydrate metabolism, or B vitamin complexes, methylation pathways, detoxification pathways, and also sometimes if there's an overgrowth of, for instance, acidophilus, it can be sequestered through the bladder and the metabolites go through the urine, and that's what we're testing for. So that's one of the particular tests that we can do. Another test is a comprehensive stool analysis. What most people don't know is 40% of all adults have a parasite that they don't know about.
Is that right?
Yes.
How do we get that? Where does that come from?
Oh, it can come from mostly food, from traveling, food, poor water.
What are some signs and symptoms of that?
Those could range from fatigue, chronic fatigue, headaches, nausea, vomiting, acid reflux, regurgitation, things like that.
So for each person, it might be a little bit different, but if you're
Absolutely.
starting to develop some of the symptoms and you can't explain why you're starting to feel a certain way, it might not be a bad idea to come and see you and
Absolutely.
have a little bit of this testing done.
Exactly. Sometimes, even if you were to go to, for instance, Nepal, you might not feel the symptoms of what we would consider IBS for 6 to 12 months afterwards, because these particular bacteria, some take a long time to develop, and then you can have subclinical signs and symptoms, and then eventually have outward signs and symptoms after a long period of time.
Margaret has called 361-4675. Hi, Margaret. You're on with Dr. Payant.
Hello. I have eczema, and I'm wondering if that would in any way be helped by taking care of my gut better.
That's another really good question. We do find that the gut health is going to have a direct effect on skin. So people with rosacea, eczema, things like that, it usually is coming from the gut.
So Margaret, are you still with us? Do you suffer from, I say eczema, I say it a little bit differently than you. Do you suffer from eczema now?
Yes, I do. And I'm really wondering what can help this. So this is a good thing for me to look forward to.
Dr. Payant, what would you tell Margaret to help alleviate some of that inflammation?
Sure. Well, I would have her come in and we would do some testing, probably an organic acid test or a comprehensive stool analysis, again, to find out exactly what's in the gut as opposed to what should be there, and take a full history. Again, sometimes a patient has gone to a foreign country and picked up a parasite that they didn't know about until years later.
Thank you, Margaret, for calling 361-4675. Once again, we are joined here on Local Doctors on Call by Dr. Misha Payant, president of East West College of Natural Medicine, and we're taking your calls here live. I just wanted to make sure before we go to a break that we wrap up digestive health with this particular topic of probiotics and some of the inflammation. How would you like to end this discussion before we move on?
Another thing about the probiotics is it's great to have those biota, but you have to give them a place to live and a place to eat, and that's the lining of the gut. So in some cases, before we give a patient probiotic, we have to put the gut in a habitable environment. So we have to give them the food to survive.
When we come back from this break, we will be joined by Susan, a patient of Dr. Payant's at East West College of Natural Medicine. Stay with us. We'll be right back.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Hello, I'm Dr. Misha Payant, president of East West College of Natural Medicine. For over 20 years, we've been helping our patients improve their health and, more importantly, maintain their health by using Oriental and Western medicine. Many of our patients refer to us as the best kept secret in Sarasota. Call today to schedule your consultation or for more information regarding our program in Oriental Medicine. East West College of Natural Medicine. It's not a secret anymore.
Misha Payant, president of East West College of Medicine. And we are also joined by Susan, who is one of your patients. Susan, thank you so much for joining us.
Yes, thank you.
We appreciate you doing that. When did you determine that you needed to go see Dr. Payant and have a few tests done for yourself?
Well, I've always been interested in health and taken a lot of supplements, but I reached a point where I realized I needed some help and some guidance because I had symptoms that I wasn't able to deal with. And I found out about the lab work that was being offered. And so the first test I had taken was the organic acid test. And I had previously taken the genetic testing on my own, and because I did not know anyone who did that, but I was not able to interpret or use that information, so I needed some help with that.
What were some of your symptoms? What were you experiencing that made you feel like I'm just not feeling myself?
Well, one of the biggest ones that was noticeable to me was gaining weight. I had a lot of anxiety. I had aches and pains, stiff knee. I had indigestion a lot and acid reflux that was really troublesome. And I wasn't, no matter what I tried, everything I heard about, nothing seemed to help.
So how did you find East West College of Natural Medicine, and what made you decide to go?
Well, I had heard about the lab work, which is relatively new, and I did not know that this lab work was available and that I could get individual help of what I needed, because I just took things because I thought they would be helpful, but I didn't know if they would work for me.
And were you treating symptoms of things? So you found yourself using a lot of
I was taking all kinds of products. So I thought that if I'm going to spend all that money on products, why not put that into finding out in the tests what would be useful for me.
And Dr. Payant, what did you determine in doing some testing with Susan that you found surprising and you were able to help?
Sure. Well, one of the things that Susan mentioned, we did a genetic profile. She had the raw material, and what I was able to do is run that through an application, and what I get are, what we pull is 602,000 genes, and we run that through an application, and it pulls out over 600 polymorphisms,
What
or
is that?
individual genes.
Okay, individual genes?
Right.
Wow.
And a polymorphism basically is a gene that's not working at its optimal level or producing what it should.
What does that show on a test? What does that look like? I mean, do you actually see a ding?
No,
it's a damage.
it's pretty colorful. You have a list of a bunch of numbers, which is a gene, like serial number, if you will.
Okay.
And then a gene name, if you will. And then a lot of red, green, and yellow. A green means that the gene is probably working at 100%. Yellow is what's called heterozygous. So you have, if you will, a bad component from one parent and a good component from another parent. That's heterozygous. And then we have a red, and that's a homozygous, where you have two bad genes from both parents. And then the heterozygous means, think of it as like a 12-lane highway. A green has a 12-lane highway, the traffic's going through, it's fine. Mm-hmm. A yellow, you have 12 lanes of traffic going through an 8-lane highway. Mm-hmm. So you get a little backed up. Mm-hmm. It's probably working maybe 60%. A red is taking those 12 lanes and going to a 2-lane highway. So now we're working maybe 6 to 8%.
Before we continue, I want to get the calls that are on the line in, and we'll continue with this discussion. 361-4675 is our telephone number. We have Amanda on the line with us. Amanda, you've called Local Doctors on Call. Thank you. What can we do for you?
I've heard that the problems with the gut could be causing aches and pains and that sort of thing. And I was wondering if it might possibly be linked to endometriosis.
That is a little bit different.
Okay.
Of course, gut pain can cause inflammation, systemic inflammation, but endometriosis is it's a little bit different.
Okay. But we will be talking a little bit about the genetic testing and some of the other things that it will show coming up here in just a few minutes. Amanda, thank you for your call. We have Sky. Sky is called 361-4675. Hi, Sky. Thank you for calling.
Hi, thank you for this wonderful program. My question is short. The tests sound wonderful, and I just wondered if Medicare covers any of them.
Great question.
That is a very good question. What we can do is give the patient a super bill, and they can submit it to Medicare, but oftentimes they will not, unfortunately. Okay. However, these tests are for most people, they're pretty economical and affordable. The genetic profile test, years ago, might cost thousands of dollars. Today, you can get your genetic raw material for $99.
And that's your roadmap. I mean, that's
right.
Your roadmap to health to be able to figure this out.
Absolutely.
When we come back, we'll talk a little bit more with you, Susan, and we'll find out a little bit more to some of the solutions and what Doctor discovered when we come back. You are watching Local Doctors on Call. We're talking about digestive health with East West College of Natural Medicine. Call us with your questions for Dr. Payant at 361-4675. We'll be right back.
Hello, I'm Dr. Misha Payant, President of East West College of Natural Medicine. For over 20 years, we've been helping our patients improve their health and, more importantly, maintain their health by using Oriental and Western medicine. Many of our patients refer to us as the best-kept secret in Sarasota. Call today to schedule your consultation or for more information regarding our program in Oriental Medicine. East West College of Natural Medicine. It's not a secret anymore.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Welcome back to our final few minutes of Local Doctors on Call. If you have any questions, this is the chance to sneak in those calls at 361-4675. Dr. Payant and his patient Susan here from East West College of Natural Medicine, talking a little bit about Susan's roadmap. Again, what did you discover and how did you offer some solutions for Susan?
Well, we did notice that there were some genes that led us to believe there was a predisposition for some estrogen-dominant cancers like breast cancer, ovarian cancer. And just knowing that, we were able to supplement her to help prevent those from occurring.
How do you do that? What was the solution that you offered? And what does it do, lower estrogen there?
So one of the mainstays of the therapies are using high-dose cruciferous supplements, Brussels sprouts, kale, and things like that, but using a high dose. And what that does is studies show that it prevents one particular type of estrogen converting into a bad form of estrogen, if you will, which would causes those cancers. So high-dose cruciferous is one of those supplements.
And what else did you see in Susan's roadmap?
Susan had some genes that led us to believe that there are a lot of neurotransmitters that are excitatory and not the neurotransmitters that calm someone down probably aren't working as well as they should. So this gives a patient the feeling of being wired and tired, always thinking, the brain's always going, and you're exhausted from that. So knowing that information, again, we were able to give her supplements to help those genes do their job. We can't necessarily fix genes. These are the genes that you're born with, and you're going to live with them. But knowing the hand you're dealt doesn't mean that you're going to win. It's how you play the cards.
And before we take our next call, Susan, are you feeling better? Do you see some results for yourself now?
Oh, I do. One of the immediate results I had was food cravings disappeared, because before I would crave sugar, chocolate, carbohydrates. That was the first thing I noticed, which was surprising to me. The second thing was that I didn't need as much food as I did before. I didn't have this ravenous appetite and never felt like I was full, like I always needed something more. That went away. So that was the immediate. And then I could tell that my anxiety level started to come down, aches and pains improved. I lost over 10 pounds I didn't diet, I just changed my eating. And those were the biggest improvements.
All right, let's take David's call. David, you've called 361-4675 for Dr. Payant. Hi, David.
Hi there.
How can we help you tonight?
I'm interested in the genetic profile testing that Dr. Payant is speaking about, and I was wondering if he might be able to tell us a little bit more about what the process of having that test done is.
Great question, David. Thank you. We were going to wrap up with that, so that's a perfect timing. What can you share with us?
So what I would recommend is, if you're interested in having your genetic profile read, is to contact the college, and what we will do is send you a link to order the kit. And once the kit's ordered, you send it in. It's a saliva test. You'll get the results back, the raw data, and then you contact the clinic again. We'll take the raw data, and I'll interpret that, and we can set up an appointment to have it interpreted and with the patient.
Does that take a long time?
It takes the lab probably about 3 weeks. And again, the cost of it's only $99, so they work in volume. So a lot of people are wanting their genetic profiles read. So it takes about 3 weeks to get the information back from the lab. And because it's a 45-page report, it takes me a couple days to interpret that.
So it will be very hard for us to decipher. As the layperson, we won't be able to really figure this out.
It would be a nightmare.
Okay. Susan, was it a nightmare for you?
Yes, I had all the information, but it made no sense, and I didn't know what to do with it.
So tell me more about the anxiety that you say you were facing, and how are you feeling now? How do you feel that by having this roadmap, the anxiety is now suppressed a little bit?
Well, anxiety seemed to be triggered by stress, and the more stress, the more my anxiety rose. And I had at one point started to have panic attacks, which I had never had before, and I didn't really know what it was. And I wasn't able to calm myself down, which was surprising. I thought I could just think my way through that, but that didn't work. So I am much calmer now, more centered. I just feel better. I'm in a better mood. It's been a huge improvement for me.
So I think what Susan is saying from our conversation before we came on the air, her neurotransmitters, how good am I, were going crazy. Is that
Right.
what was happening?
Exactly.
Tell us why.
Again, her genetic profile showed her excitatory neurotransmitters are always firing, and the transmitters that calm someone down just weren't working. They were that two-lane highway.
Okay.
So we gave her some supplements to help work around that, and we get really good results, positive results.
Is that our fight or flight mechanism that you're referring to? Is that one of the symptoms of a firing of that?
Absolutely, absolutely.
So why would that have been happening with Susan? Is it just stress can really kick those off at the wrong time?
That and your genes. It's just the genetics, and not having the materials nutritionally to help the other genes, the other neurotransmitters, do their job.
Do you believe at East West College of Natural Medicine that you are able to bring in natural solutions that we can find at the grocery store?
Absolutely. You know, we teach all our students to tell their patients, you have the best two tools for optimal health, feet and forks. You have to move, exercise, and eat properly, and most of us physicians would be out of business.
You know, when I'm on a long road trip, I don't know if you've ever done this, and I take a bag of grapes, I notice that as I eat those grapes that I actually start to feel better on the road trip, and if I don't have something like that with a lot of water in it or a lot of nutrition like that, that I actually start to feel myself slipping back. So am I nuts?
No, no, but nuts would actually be a good addition to your snacks.
Okay.
They have high fat, good fat content, protein.
So really you are what you eat. That's not a joke. I mean, that is it.
Actually, we are what we eats. So for instance, cows, why do farmers give them antibiotics? Not because they're afraid that they're going to get a cold or a flu, it's to make them fat. Same thing with chickens. That's why they give chickens antibiotics. So the same thing applies to us. We give our children antibiotics, and that just leads to obesity.
As we get ready to close tonight, I wanted to give you an opportunity to talk about your open house on Thursday night.
Sure. We are having an open house at East West College of Natural Medicine Thursday from 6 to 8, and we invite people who are interested in becoming a patient and also people who would be interested in becoming a student of Oriental Medicine.
So what will happen? You'll give me a tour? You'll
Absolutely.
Tell us a little bit more.
We'll have tours of the college. We'll have demonstrations, lectures, and you'll be able to talk to the physicians and some of the students.
Will you be there, Susan?
I will.
Shaking hands?
Sure.
Very good, very good. So you're a celebrity now.
Thank you.
East West College of Natural Medicine is located at 3808 North Tamiami Trail. Again, an open house this Thursday night from 6 to 8 to learn more about becoming a patient or a student of Oriental or Functional Medicine. Their number there is 941-355-9080 for more information. Dr. Misha Payant and his patient Susan, thank you so much for joining us.
Thank you very much.
I really enjoyed this, and I think everybody finds this very much beneficial, even though we don't realize we are being affected by the foods that we eat. So thank you for keeping that front of mind for us.
Thank you very much.
Thank you. For Dr. Payant and Susan, I'm Suzanne Lee. You're watching Local Doctors on Call. We'll see you next month with Dr. Payant.
Thank you.
Good night.